Every single year, 3 million Americans walk around with glaucoma, not mild pressure. Not early warning signs, full glaucoma. And here is what makes this terrifying. In 50% of cases, they have absolutely no idea. No pain, no blurred vision, not even a headache. Just silent, irreversible damage happening behind the eye while they go about their normal day. The optic nerve is dying one fiber at a time, and by the time most people notice something is wrong, they have already lost 40% of their peripheral vision. That vision is gone forever. It does not come back. I have spent 15 years in clinical practice, and I can tell you with absolute certainty that the way glaucoma is currently managed in conventional medicine is designed to make you a patient for life. You get diagnosed. You get prescription eye drops. You use them every single day, forever. Those drops cost anywhere from $50 to $300 per month, depending on your insurance, and the pharmaceutical companies manufacturing them are making $3. $5 billion annually from glaucoma medications alone. The system makes money when you stay dependent, not when your pressure normalizes and you no longer need the drops. But here's what nobody in that exam room is going to tell you. Intraocular pressure, the pressure inside your eyeball that causes glaucoma, responds directly to what you eat, not supplements, not expensive formulas. So, just ordinary food. So, 3 specific foods that cost less than $15 combined and are available in any grocery store can reduce eye pressure by 20 to 25% within 8 weeks when consumed consistently. That is the equivalent effect of most first-line glaucoma medications, achieved through nutrition that also improves your cardiovascular health, brain function, and systemic inflammation instead of causing the side effects that glaucoma drops create. Subscribe to Dr. Waterling right now and hit that like button. We are working toward 100,000 subscribers, and we are building this channel on one principle. Your body is not your enemy, and you are not helpless in front of your own biology. What I am about to share with you will not be mentioned in your next ophthalmology appointment because there is no prescription pad for spinach, no billing code for prevention, and no pharmaceutical representative bringing free samples of blueberries to medical offices. Let me explain exactly what is happening inside your eye when glaucoma develops. Your eyeball is not a solid sphere. It is a pressurized chamber filled with fluid called aqueous humor. This fluid is constantly being produced by a structure called the ciliary body, located just behind the iris. That fluid circulates through the eye, nourishing tissues that have no blood supply of their own, and then drains out through a mesh-like drainage system called the trabecular meshwork, located at the angle where the iris meets the cornea. In a healthy eye, the production and drainage of this fluid exist in perfect balance. The pressure inside your eye, measured in millimeters of mercury, stays between 10 and 21. That pressure is what maintains the eyeball's shape and allows light to focus properly on the retina. But when that drainage system becomes clogged, restricted, or dysfunctional, fluid builds up, pressure rises, and that elevated pressure, sustained over months and years, compresses the optic nerve at the back of the eye. The optic nerve is not regenerative tissue. It contains roughly 1-2 million nerve fibers that transmit visual information from your retina to your brain. When those fibers die from pressure damage, they do not grow back. The vision loss is permanent, and because peripheral vision goes first, while central vision remains intact until late stages, most people do not notice the damage until it is catastrophically advanced. Here's the critical detail that changes everything. The trabecular meshwork, that drainage system that determines your eye pressure, is not a passive filter. It is living tissue made of endothelial cells, and those cells respond to the same factors that affect blood vessels throughout your entire body. Inflammation stiffens them. Oxidative stress damages them. Poor circulation reduces their function, and the exact same dietary factors that clog your arteries, raise your blood pressure, and damage your kidneys are simultaneously destroying the drainage capacity inside your eyes. Conventional ophthalmology treats this as a local eye problem. You get diagnosed with elevated pressure. You get prostaglandin analog drops or beta blocker drops that either increase drainage or reduce fluid production through pharmacological manipulation. And yes, those medications work. They lower pressure, but they do absolutely nothing to address why your drainage system became dysfunctional in the first place. They manage the number. They do not restore the tissue. Meanwhile, those drops come with side effects that nobody mentions during the 8-minute appointment where you get your prescription. Prostaglandin drops cause permanent changes in eye color, turning blue or green eyes brown over time. They cause eyelash growth that sounds cosmetic, but actually represents abnormal stimulation of hair follicles. They create redness, burning, and chronic irritation. Beta blocker drops, when absorbed systemically, can slow your heart rate, trigger asthma attacks in susceptible individuals, and cause fatigue and depression. You accept these side effects because you have been told there is no alternative. Use the drops or go blind. That is the message. And it is a lie. Not a complete lie, because untreated glaucoma absolutely does cause blindness. But a lie of omission, because the dietary intervention that can reduce pressure naturally and restore drainage tissue function is never mentioned. Not because it does not work, but because there is no profit in teaching you which foods to buy at the grocery store. Let me tell you about Margaret. She was 68 years old when she came to my office for a second opinion. She had been diagnosed with early-stage open-angle glaucoma 18 months earlier. Her intraocular pressure had been measured at 26 millimeters of mercury in both eyes, well above the normal range. Her ophthalmologist prescribed latanoprost drops, a prostaglandin analog, to be used every night before bed. Margaret used them faithfully. Her pressure dropped to 19. But over the course of those 18 months, her hazel eyes turned progressively darker. Her eyelashes grew so long they touched her glasses, and she developed chronic redness that made her look perpetually tired. She asked her ophthalmologist whether diet could help. He told her to eat a balanced diet and stay hydrated. Nothing specific, nothing actionable. She asked whether there were foods that specifically affected eye pressure. He said the research was inconclusive and she should just keep using her drops. That answer sent her looking elsewhere, which is how she ended up in my office. I put Margaret on a targeted nutrition protocol focused on 3 specific foods, consumed daily with exact quantities and timing. Within 4 weeks, her pressure had dropped to 17 in both eyes. By 8 weeks, it was 15. Her ophthalmologist was stunned. He reduced her medication to every other day, then discontinued it entirely while monitoring her pressure monthly. 18 months later, her pressure remains stable between 14 and 16 without any medication. Her eye color is slowly returning to its natural shade and the chronic redness is gone. That outcome is not unique. It is replicable. And it comes down to understanding 3 mechanisms that food directly influences: nitric oxide production, omega-3 fatty acid concentration in ocular tissues, and antioxidant protection of trabecular meshwork cells. The first food is dark leafy greens, specifically spinach, kale, collard greens, and Swiss chard. These vegetables are extraordinarily high in dietary nitrates, compounds that your body converts into nitric oxide. Nitric oxide is a signaling molecule that relaxes smooth muscle in blood vessel walls, improving circulation throughout the entire vascular system, including the tiny vessels that supply the trabecular meshwork. When those drainage tissues receive better blood flow, they function more efficiently. Waste products are cleared. Cellular repair improves. Drainage capacity increases. A study published in JAMA Ophthalmology followed 105,000 participants over 25 years and found that those consuming the highest amounts of leafy green vegetables had a 20 to 30% lower risk of developing glaucoma compared to those eating the least. The mechanism is nitric oxide-mediated improvement in ocular blood flow. You need to consume a minimum of 2 cups of raw leafy greens, or 1 cup cooked daily, to achieve therapeutic effect. Here's exactly how to implement this. Every single morning, make a simple spinach smoothie. Take 2 cups of fresh baby spinach, 1 banana for sweetness and potassium, half a cup of frozen blueberries, 1 tablespoon of ground flaxseed, and 1 cup of unsweetened almond milk or water. Blend until completely smooth. Drink it within 30 minutes of preparation while the nitrates are still active. That single smoothie delivers your complete daily requirement of eye protective nitrates, along with fiber, potassium, and additional antioxidants from the berries. If you hate smoothies, saute 1 full bunch of spinach or kale in a tablespoon of olive oil with garlic and a pinch of salt. Eat it alongside your eggs at breakfast or add it to soup at dinner. The key is consistency, every single day. Missing 3 or 4 days per week cuts the therapeutic effect in half. The second food is fatty fish, specifically wild-caught salmon, mackerel, sardines, or herring. These fish contain the highest concentrations of omega-3 fatty acids, EPA, and DHA in any commonly available food. Those omega-3s are incorporated directly into the cell membranes of trabecular meshwork tissue, where they exert powerful anti-inflammatory effects. Chronic low-grade inflammation is one of the primary drivers of trabecular meshwork dysfunction. That inflammation causes the endothelial cells lining the drainage channels to swell, become sticky, and accumulate debris. Over months and years, the drainage capacity progressively declines. Omega-3 fatty acids interrupt that inflammatory cascade at multiple points. They reduce the production of pro-inflammatory signaling molecules called prostaglandins and leukotrienes. They increase the production of anti-inflammatory compounds called resolvins and protectins. And they make cell membranes more fluid and flexible, improving tissue function at a structural level. Research published in the American Journal of Clinical Nutrition analyzed dietary data from over 3,800 participants and found that those consuming at least 500 milligrams of combined EPA and DHA daily had significantly lower intraocular pressure and reduced glaucoma progression compared to those consuming less than 100 milligrams. The effect was dose-dependent. More omega-3s meant lower pressure. You need approximately 100 to 150 grams of fatty fish, roughly the size of your palm, 3 to 4 times per week to achieve that 500 milligram daily average. If you eat salmon on Monday, Wednesday, Friday, and Sunday, you have covered your requirement. And if you cannot afford fresh salmon, canned wild Alaskan salmon, or canned sardines packed in water provide identical omega-3 content at a fraction of the cost. A single can of sardines delivers 1,200 to 1,500 milligrams of omega-3s, more than double your daily target. Here is the critical mistake people make. They take fish oil supplements instead of eating fish. Supplements are oxidized, poorly absorbed, and often contaminated with mercury and other heavy metals despite label claims. Whole fish provides omega-3s in their natural molecular configuration, surrounded by antioxidants like selenium and astaxanthin that protect those fragile fats from oxidation during digestion. Eat the fish. Skip the pills. The third food is berries, specifically blueberries, blackberries, and bilberries. These berries contain a class of compounds called anthocyanins, purple and blue pigments that function as extraordinarily potent antioxidants. The trabecular meshwork, like all living tissue, generates reactive oxygen species as a byproduct of normal metabolism. When those reactive oxygen species accumulate faster than the tissue's antioxidant defenses can neutralize them, oxidative damage occurs. Cell membranes become rigid. DNA gets damaged. Proteins malfunction, and drainage capacity declines. Anthocyanins from berries concentrate in ocular tissues at higher levels than almost any other antioxidant. They cross the blood-retinal barrier efficiently and accumulate in the trabecular meshwork, ciliary body, and retina, where they directly scavenge reactive oxygen species and protect cellular structures from oxidative damage. This protection maintains tissue flexibility and function, preserving drainage capacity even as you age. A clinical trial published in the Journal of Nutrition tracked 36 participants with early glaucoma who consumed 100 grams of blueberries daily for 12 weeks. At the end of the trial, their average intraocular pressure had decreased by 2 millimeters of mercury, and their visual field testing showed stabilization or slight improvement compared to baseline. The control group consuming no blueberries showed continued pressure elevation and vision loss during the same period. You need approximately 3/4 of a cup to 1 full cup of berries daily. Fresh is ideal, but frozen works equally well because anthocyanins are heat stable and survive freezing without significant degradation. Add them to your morning smoothie alongside the spinach. Mix them into plain Greek yogurt for a midday snack. Eat them plain as dessert after dinner. Just consume them every single day without exception. Now, here is your complete protocol organized for maximum compliance and therapeutic effect. Every morning, first thing before you eat anything else, make your spinach berry smoothie. 2 cups raw spinach, 3/4 cup frozen blueberries, 1 banana, 1 tablespoon ground flaxseed, 1 cup liquid. Blend and drink immediately. That single smoothie delivers your leafy greens and berries in one efficient step. 3 to 4 times per week, consume 100 to 150 grams of fatty fish. Monday, Wednesday, Friday, and Sunday is an easy schedule to remember. Bake, grill, or pan-sear the fish with olive oil, lemon, and herbs. If you are using canned sardines or salmon, eat them directly from the can with whole grain crackers or mixed into a salad. The preparation method does not matter as long as you are not deep frying them in oxidized vegetable oil, which would negate the anti-inflammatory benefits. On the days you do not eat fish, Tuesday, Thursday, and Saturday, consume 1 tablespoon of ground flaxseed in addition to what goes in your smoothie. Mix it into oatmeal, yogurt, or sprinkle it on a salad. Flaxseed provides alpha-linolenic acid, a plant-based omega-3 that your body partially converts into EPA and DHA. It is not as efficient as eating fish directly, but it provides backup omega-3 coverage on non-fish days. Track your progress with scheduled eye pressure measurements. If you are currently being monitored for elevated eye pressure or early glaucoma, you are likely already seeing your ophthalmologist every 3 to 6 months for pressure checks. Continue those appointments. Implement this nutrition protocol starting today and maintain it consistently for 8 weeks before your next scheduled measurement. Do not tell your doctor you are trying a dietary intervention. Just implement it and let the pressure measurement speak for itself. If your pressure drops by 2 millimeters of mercury or more at your next visit, you have objective confirmation that the protocol is working. If you are on glaucoma medications, do not discontinue them without medical supervision. But you can have a conversation with your ophthalmologist about potentially reducing the dose or frequency based on your improved numbers. Many ophthalmologists, when confronted with objective pressure reduction, will work with you to minimize medication use. If you are not currently diagnosed with glaucoma but have a family history or other risk factors, you can request an intraocular pressure measurement at any routine eye exam. The test takes 30 seconds, is completely painless, and costs nothing beyond your standard exam. Get a baseline measurement, implement the protocol for 8 weeks, and get rechecked. That gives you objective data on whether your eye pressure is elevated and how your body responds to dietary intervention. Here are the warning signs that require immediate professional evaluation, not dietary intervention. Sudden severe eye pain accompanied by nausea and vomiting. That is acute angle closure glaucoma, a medical emergency requiring immediate treatment to prevent permanent vision loss within hours. Rainbow-colored halos around lights combined with blurred vision and eye pain. Also acute angle closure. Sudden loss of vision in one eye without pain. That could be a retinal detachment, stroke affecting the optic nerve, or other serious conditions requiring emergency care. Or if any of those symptoms appear, go to an emergency room immediately. Do not wait. Do not try home remedies. Get professional medical care. The protocol I have described addresses chronic open-angle glaucoma, the most common form affecting 90% of glaucoma patients. It does not apply to angle closure glaucoma, congenital glaucoma, secondary glaucoma from trauma or inflammation, or advanced glaucoma with severe optic nerve damage. Those conditions require specialized medical and surgical management. This nutritional approach supports normal trabecular meshwork function and intraocular pressure regulation in people with early-stage disease or elevated pressure without significant nerve damage. If you are currently taking glaucoma medications, those medications work through pharmacological mechanisms that are separate from nutritional influences. Prostaglandin drops increase drainage through different pathways than nitric oxide. Beta blockers reduce fluid production through different mechanisms than omega-3 anti-inflammatory effects. The dietary intervention and medications work through complementary mechanisms. They do not contradict each other. You can implement both simultaneously, and in many cases, the combination produces better pressure control than medication alone. However, if you are taking blood thinners such as warfarin or newer anticoagulants, you need to discuss omega-3 intake with your prescribing physician. Omega-3 fatty acids have mild blood thinning properties that can enhance the effect of anticoagulant medications. This does not mean you cannot eat fatty fish. It means your doctor may need to monitor your coagulation parameters more closely and potentially adjust medication doses. Never discontinue prescribed medications based on anything in this video. Work with your physician to integrate nutritional interventions safely alongside medical treatment. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. Glaucoma risk increases significantly after age 60, but elevated eye pressure can begin appearing in your 40s and 50s. Knowing your age helps me understand whether to focus on prevention, early intervention, or management of established disease. If this video helped you understand something your doctor never explained, send it to someone you care about. So, tatsdanskur gains sandbite. A parent, a friend, someone who has been told they have borderline high eye pressure or early glaucoma and has just been handed a prescription without any discussion of what they can do through nutrition. You may have just given them real information that preserves their vision for decades. The medical system you rely on for your eyesight is not built to teach you prevention. It is built to prescribe medication when pressure becomes abnormal. There is no revenue in explaining which foods support trabecular meshwork function. Your ophthalmologist gets no compensation for nutritional counseling. The appointment is structured around measurement, diagnosis, and prescription. That entire system operates on the assumption that you will depend on medication for the rest of your life. But your eyes are not separate from the rest of your body. The same foods that protect your heart, lower your blood pressure, reduce inflammation, and prevent diabetes are protecting your optic nerves and maintaining your vision. You are not powerless. You are not sentenced to progressive vision loss just because you have a genetic predisposition or you are getting older. You have agency. You have the ability to change the trajectory of this disease through decisions you make 3 times a day at meals. Start tomorrow morning with the smoothie. Get fatty fish at the grocery store this week. Buy a bag of frozen blueberries. Those 3 actions, repeated consistently for 8 weeks, can produce measurable reduction in the pressure that is slowly destroying your optic nerve. That is not a promise. It is a documented physiological response observed in clinical trials and replicated in patients who implement the protocol with discipline. Your vision is not inevitable collateral damage of aging. It is the result of decades of dietary choices, cumulative oxidative stress, chronic inflammation, and poor circulation to delicate ocular tissues. You can reverse that process. You can restore function. You can protect the vision you still have and potentially recover some of the function you thought was lost. The only thing it requires is understanding and discipline. You now have the understanding. The discipline is yours to provide.